There have been recommended steps published to guide the cultural adaptation process by Professor Comfort in 2008. There was also a longer monograph published by the United Nations the United Nations Office of Drugs and Crime called A Guide to Implementing Family Skills Training Programme for Drug Prevention. And this was also written by Dr. Comfort and an expert working group who gathered in Vienna in 2009. And Castro and colleagues in 2010 also published several cultural adaptation stage models to guide the transportation and dissemination of evidence-based practices and programs while retaining fidelity to the core concept. The steps to culturally adapting the Strengthening Families Programme 12 to 16-year-old at-risk version are outlined in the slide in Table 2, and apologies for the small font. I know it's difficult to read. But these are the steps that guided the cultural adaptation process in Ireland. So the original programme contained what we call distracting Americanisms. These were irritating to the, no offence, Rob. These were irritating to the group leaders and to the families, but apparently didn't affect the outcomes at all. Once we began to recognise this, we conducted what we call a light touch adaptation process, and this involved gathering programme and process fidelity feedback from the group leaders at the end of each session each week in a number of implementations in the south of Ireland. The adaptation of the group leader manuals and curriculum involved changing spellings, names, terminology, and some of the activities. A compendium of alternative group games and activities was added to the group leader manuals for the team programme, and this was to encourage the group leaders to continue the adaptation process, to continue adapting the programme to make it fit for whatever context it was being delivered in, while also trying to ensure that the core concepts were adhered to. It's important to note that our cultural adaptation process didn't change the original structure of the programme. It didn't change the core content. The sessions remained at 14 weeks to allow for adequate dosage and to give the families enough time to incorporate these skills into their family lives and to change. And we also conducted an outcome study, and the study used what is called a quasi-experimental evaluation design, and it consisted of recruiting 250 families right across Ireland to participate in the Strengthening Families programme and also to complete an outcome evaluation questionnaire. We used a repeated measures pre- and post-test retrospective questionnaire design with post hoc comparisons to the Strengthening Families programme international norms. The self-report questionnaire has 21 standardised subscales embedded in the testing battery that are well known and recognised in the field. And the evaluations were conducted in multiple sites all over Ireland with individual agency reports recommending improvements if any of the effect sizes were smaller than the standardised Irish norms. The instruments were delivered by site staff to assess multiple areas of parent, child and family functioning. And I hope I'm on the right slide again, but there were statistically significant results in all of the 21 outcomes that were measured. Statistically significant only means that the mean differences that were reported from pre to post test are likely to represent true positive changes in the families and not likely to have occurred by chance. 13 of the outcomes had large effect sizes, and these are more important statistical outcomes, as effect size is the way that researchers measure the percentage of change that occurs after participating in a program like the Strengthening Families program. We had larger improvements in the programs in Ireland compared to the international norms, and I'd like to think that that could be explained by my hard work, but apparently that's not the case. There's a better explanation for it. One explanation is that the families that we recruited were already in crisis or in more pain because they were already beginning to have behavioural problems and had already begun to use substances. They were referred by probation officers, social workers, community drugs project workers, and homeless services. So, statistically, the Irish families had lower pre-test scores on positive family variables and higher scores at baseline on negative family variables such as family conflict. And this would have created more room for improvement and also could have created a greater incentive for these families to change. So, the outcome results for the Strengthening Families programme in Ireland have been very encouraging. We've had statistically significant improvements and large effect sizes. These reductions in risk factors and improvements in protective factors should lead to emergent effects and according to the tested theoretical models should reduce drug and alcohol use over time. And I'll finish on this point because I know I'm running out of time. I think that when we look at what we're working on together, whether you work in Arba House where I work or in any of the agencies where you work, I think the common factor that we have is that we're all trying to disrupt the trajectories of young people and families into social exclusion. To do that, we need to understand what formulates those trajectories. We need to know how to intervene or disrupt them, and more importantly, we need to know how to redirect those families into a more inclusive direction where they can contribute to and benefit from society. So thanks for listening, and I can try my best to answer any questions if you have questions afterwards.